Let's talk about treatment for premature ejaculation. So the first line treatment, the most obvious, is the topical anesthetics, which is basically a lidocaine-like spray that goes on the penis to numb it. There's also condoms that have a numbing agent on the inside that also helps to numb the penis. This is all over the counter. You don't need a prescription for it. They sell it at any pharmacy where they sell the condoms or online. The most common brand is called Promescent, but there's plenty of others. And this has some obvious advantages. One is that you're not taking any pills or anything, so there's no real side effects or risks associated with it. Two is that it's very effective in terms of increasing the amount of time that you can have sex for. The downside, obviously, is that it does numb the penis to some extent, so that will take away some of the pleasure. The risk of numbing your partner is very low, especially if you rub in the spray, so that's not a real concern. But a lot of people don't want to deal with the possibility of numbing themselves to take away from their pleasure, so they look to other options. So all the other options are basically pills. And the first thing to know is that if you have erectile dysfunction and premature ejaculation, you need to treat the erectile dysfunction first. But even in some men who don't have erectile dysfunction, if they just have premature ejaculation, they will sometimes try the ED pills like the Viagra and the Cialis. Now those pills won't necessarily help you last longer, but in some men, even if they have a premature ejaculation, if they're on those pills, the latency period, meaning the time that it takes for them to be able to get another erection, is significantly decreased. So sometimes they can have sex twice in a row and then last a lot longer the second time. That is somewhat off-label, not really intended to be used for that reason, but if the medicine works in that way and there's no side effects, then that's fine. If you look at the official urology guidelines, the first line treatment in terms of pills is basically the antidepressants, the SSRI, which are selective serotonin reuptake inhibitors. Those are the most common antidepressant and anti-anxiety pills that people take for those reasons. And the TCAs are tricyclic antidepressants, less commonly used for depression, but also works for premature ejaculation. So those pills are very effective in treating premature ejaculation, but obviously there's potential side effects with starting somebody on an antidepressant if they don't have depression or anxiety. So obviously if the patient does have untreated depression or anxiety, then that's a great option, and I would recommend that they see their primary care doctor or psychiatrist and consider starting one of those pills, and that's an added side effect of treating their psychiatric issues. It is still an option for men who don't have depression or anxiety to go on those pills to treat premature ejaculation, but I usually don't recommend it because there are other options. There is also the option, instead of taking an antidepressant every day and sort of being on an antidepressant for life, is just taking it as needed 3 to 6 hours before sex. Now that's less effective in terms of being able to last longer, but you don't have to take a pill every day, and that's another option. The second line treatments in terms of pills, the first one is called Tramadol, which is a form of opioid or narcotic pain medication, and you would obviously need to have that prescribed, and it's a very controlled substance, and I've never prescribed that for this reason. It seems like a lot to start an opioid pain medication to treat this type of condition, but it is in the guidelines, it is reasonable. And then the other second line options are called the alpha adrenergic antagonist, which are basically like the Flomax of the world. They're mainly used for men with large prostates to help them urinate better, but there's some evidence that it might help with premature ejaculation, so it's something to consider, especially if the patient is also having issues with urination, which is also very common in men. So if you're a patient that has this premature ejaculation, just know that it's extremely common. It's nothing to be ashamed about or embarrassed about, and it can cause a lot of distress for patients and their partners, and getting it treated is not a huge deal, so just see your urologist. Obviously they'll do a thorough history physical exam, a lot more than we can do over the course of a video just speaking to a general audience, and they'll discuss with you the different options, and you can decide which one works best for you. Or if you don't want to meet with a urologist or you don't have the time, just go to the store and you can try these anesthetic agents promescent spray or the condoms with the anesthetic on the inside, and see if that works for you. But either way, there's no reason to be ashamed. You should get it treated and improve your quality of life.